Thank you, Gloria, for that report. At the center of these are patients who are in hospital and deserve service, but the push and pull does not help the situation. Something to look into. Now, residents of parts of Kajiado have raised alarm over a surge in Kala Azar cases, a disease that mainly affects children. They say the illness is silently taking a heavy toll on them due to delayed diagnosis and treatment. Our reporter, Wanjiku Wanjiru, has the details.
Residents of parts of Kajiado West sub-county are living in fear following an alarming rise in Kala Azar infections. Many of the affected families who live in remote areas say delays in diagnosis and treatment have left them vulnerable to the deadly disease.
Meleta jana uniambia akuje aupeleke huko Kajiado.
Kala Azar, medically known as leishmaniasis, is a neglected tropical disease transmitted through the bite of infected sandflies. Symptoms include prolonged high fever, severe weight loss, and acute anemia, and the disease can be fatal if left untreated. Children between the ages of 2 and 15 are the most affected, leaving parents anxious and desperate for help.
Alianza kugonjeka akiwa yuko PP2. Kutembea, alishindwa kutembea. Watoto wakifika lunch au sikula lunch, ataka mboga, ataka chakula ile ya chai, ile haina mafuta. Tulichunguza tukaona tumbo amekuja juu.
Health records show that more than 214 cases have been diagnosed in the past year, including 12 cases reported in January alone. Health workers attribute the rising infections to poverty, low disease awareness, poor access to healthcare services, and late presentation by patients.
Ugonjwa ya Kala Azar ambayo imekuwa sana changamoto kwetu, imekuwa sana shida. Tunashukuru Mungu, tunapata cases, we refer them na wanaenda kupata matibabu.
Yeah, there are two types. We have that cutaneous leishmaniasis, which is kind of wounds. You can easily see some wounds in the body. They are visible and they can easily be identified as leishmaniasis. But sometimes the community just neglect, assuming it is a wound that will disappear. So until there are quite a number of wounds, or until they have spread to the body, that is when they decide to bring kids to the hospital.
Residents are now calling on the government through the Ministry of Health to intervene urgently and help contain the outbreak. Wanjiku Wanjiru, KTN.
Tonight, a grade 10 student has stunned the community at Orio Boys High School in